Center Test Prep Exam Answers 2022. Question 1. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes Option A, hypertension, bradycardia, headache. Option B, abdominal pain, hypotension, and a pulsatile mass. Option C, fever, chills, flank pain. Option D, dysuria, frequency, urgency. The correct answer is option B, abdominal pain, hypotension, and a pulsatile mass. The classic triad is abdominal or back pain, hypotension, and a palpable pulsatile abdominal mass. However, the triad is present in only a minority of patients. Question 2. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects Option A, deep vein thrombosis. Option B, acute arterial occlusion. Option C, cellulitis. Option D, compartment syndrome. The correct answer is option B, acute arterial occlusion. The sudden onset of the 6ps pain. Question 3. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A, pain medication. Option B, intravenous fluids only. Option C, immediate endotracheal intubation. Option D, neurological reassessment in 15 minutes. The correct answer is option C, immediate endotracheal intubation. A GCS of 8 or less indicates severe brain injury and an inability to protect the airway. The patient should be intubated for airway protection. Question 4. In distributive shock, the primary pathophysiology is Option A, pump failure. Option B, widespread vasodilation and increased capillary permeability. Option C, fluid volume loss. Option D, obstruction of blood flow. The correct answer is option B, widespread vasodilation and increased capillary permeability. Distributive shock, septic, anaphylactic, neurogenic, is characterized by profound vasodilation and maldistribution of blood flow, leading to a relative hypovolemia and decreased tissue perfusion despite normal or increased cardiac output. Question 5. The initial fluid resuscitation bolus for a patient in septic shock, per surviving sepsis campaign guidelines, is Option A, 250 ml of 0.9% normal saline. Option B, 500 ml of D5W. Option C, at least 30 ml/kg of isotonic crystalloid. Option D, packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is option C, at least 30 ml/kg of isotonic crystalloid. Current guidelines recommend an initial bolus of at least 30 ml/kg of 4-isotonic crystalloid solution, for example, normal saline or lactated ringers, for patients with sepsis-induced hypoperfusion or septic shock. Question 6. In the Emergency Severity Index, ESI, 5-level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as Option A, ESI level 1, Option B, ESI level 2, Option C, ESI level 3, Option D, ESI level 4. The correct answer is Option A, ESI level 1. ESI level 1 criteria require immediate, life-saving intervention. An altered mental status with severe respiratory depression requires immediate intervention, making this a level 1, most acute. Question 7. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes echymosis around the umbilicus. This finding is known as Option A, Gray-Turner sign. Option B, Cullen sign. Option C, Murphy's sign. Option D, Vrofsing sign. The correct answer is option B, Cullen sign. Cullen sign, periumbilical echymosis, and Gray-Turner sign, flank echymosis, indicate retroperitoneal hemorrhage, classically associated with hemorrhagic pancreatitis. Question 8. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is Option A, diltiazem. Option B, verapamil. Option C, metoprolol. Option D, digoxin. The correct answer is option D, digoxin. Digoxin can be used for rate control in atrial fibrillation, particularly in patients with heart failure. Non-dihydropyridine calcium channel blockers, diltiazem, verapamil, are typically avoided in FREEF due to their negative inotropic effects. Beta blockers may be used, but digoxin is often preferred as an adjunct or alternative. Question 9. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates option A, allergic rhinitis, option B, nasal mucosal secretions, option C, CSF leak, rhinorrhea, option D, sinus infection. The correct answer is option C, CSF leak, rhinorrhea. The presence of glucose in clear nasal drainage after head trauma confirms a CSF leak because CSF contains glucose, while normal nasal secretions do not. This is associated with a dural tear. Question 10. Which finding on end-tidal CO2, ECO2, monitoring indicates successful endotracheal intubation? Option A, ECO2 of 0 mm Hg. Option B, persistent ECO2 waveform with each ventilation. Option C, ECO2 of 50 mm Hg. Option D, a flat line waveform. The correct answer is option B, persistent ECO2 waveform with each ventilation. Waveform capnography is the gold standard for confirming ET tube placement. A persistent, characteristic waveform of exhaled CO2 confirms the tube is in the trachea. Zero or flatline reading suggests esophageal intubation. Question 11. A patient with known cirrhosis presents with massive hematemesis. The nurse suspects bleeding from option A, peptic ulcer, option B, esophageal varices, option C, hemorrhoids, option D, malloy-Weiss tear. The correct answer is option B, esophageal varices. In a patient with cirrhosis and portal hypertension, massive, painless hematemesis is most likely from ruptured esophageal varices, a life-threatening emergency. Question 12. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate option A, no tetanus prophylaxis needed. Option B, tetanus immunoglobulin only. Option C, STIP or TD booster. Option D, tetanus toxoid and tetanus immunoglobulin. The correct answer is option C, STIP or TD booster. For a clean, minor wound and a vaccination history of more than 10 years since the last dose, a STIP or TD booster is indicated. Tetanus immunoglobulin is for patients with unknown or incomplete vaccination history and contaminated wounds. Question 13. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ichthyomosis. Option B, rhinorrhea with glucose-negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Classic signs of basilar skull fracture include Battle's sign, postauricular ichthyomosis, raccoon eyes, periorbital ichthyomosis, hemotympanum, blood behind the tympanic membrane, and CSF leak, rhinorrhea or otorrhea, which tests positive for glucose. Question 14. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of option A, acute glaucoma, option B, retinal detachment, option C, corneal abrasion, option D, cataract. The correct answer is option B, retinal detachment. The patient's description of a curtain being pulled down or a shade being drawn over their vision is the hallmark symptom of retinal detachment. Question 15. Necrotizing fasciitis requires what priority treatment? Option A, broad-spectrum antibiotics alone. Option B, immediate surgical debridement. Option C, hyperbaric oxygen therapy. Option D, wound vac placement. The correct answer is option B, immediate surgical debridement. Necrotizing fasciitis is a rapidly progressive soft tissue infection requiring aggressive, emergent surgical debridement of all necrotic tissue. Antibiotics alone are insufficient. Question 16. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, tracheal deviation to the left, and hyperresonance to percussion on the right. The priority intervention is option A, obtain a stat chest X-ray. Option B, needle decompression at the right second intercostal space. Option C, administer albuterol nebulizer. Option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space. The presentation is classic for tension pneumothorax, trickle deviation away from the affected side, hyperresonance, absent breath sounds, and respiratory distress. Immediate needle decompression is life-saving. Question 17. A patient with suspected bowel perforation should have which initial diagnostic study? Option A, CT scan with contrast. Option B, abdominal ultrasound. Option C, upright chest X-ray. Option D, colonoscopy. The correct answer is option C, upright chest X-ray. An upright chest X-ray, or left lateral decubitus abdominal film, is the initial screening test for free air under the diaphragm, indicating a perforated viscus. Question 18. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is option B, elevated creatinine and BUN. Elevated serum creatinine and blood urea nitrogen, BUN, are the hallmark lab findings of acute kidney injury, reflecting decreased glomerular filtration rate. Question 19. A patient with anaphylaxis develops acute respiratory distress, wheezing, and hypotension. What is the priority medication to administer? Option A, albuterol nebulizer. Option B, intravenous diphenhydramine. Option C, intravenous corticosteroids. Option D, intramuscular epinephrine. The correct answer is option D, intramuscular epinephrine. Epinephrine is the first line and most critical treatment for anaphylaxis. It provides both alpha, vasoconstriction, and beta, bronchodilation, effects. Administration into the anterolateral thigh is the preferred route. Question 20. To calculate cerebral perfusion pressure, CPP, the nurse needs to know. Option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D, central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. CPP equals MAP ICP. A normal CPP is 60 to 80 mmHg. Maintaining adequate CPP is critical to ensure cerebral blood flow in patients with elevated ICP. Question 21. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is option C, tachycardia. In the early, compensatory stage of shock, the body attempts to maintain cardiac output and perfusion. Tachycardia and peripheral vasoconstriction are key early compensatory mechanisms. Question 22. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide complex tachycardia at 220 bpm. What is the priority intervention? Option A, administer amiodarone 300 mg for push. Option B, synchronized cardioversion at 100 J. Option C, immediate high-quality CPR and defibrillation. Option D, transcutaneous pacing. The correct answer is option C, immediate high-quality CPR and defibrillation. Pulseless ventricular tachycardia is a shockable rhythm treated with immediate defibrillation, not synchronized cardioversion. CPR should be initiated and defibrillation performed as soon as possible. Question 23. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Hypotension is a late and ominous sign of shock in trauma, especially in young, otherwise healthy patients. Compensatory mechanisms, tachycardia, vasoconstriction, can maintain blood pressure until 30 to 40% of blood volume is lost. Question 24. The purpose of administering surfactant to a patient with ARDS is to: Option A, bronchodilate the airways. Option B, reduce alveolar surface tension and prevent atelectasis. Option C, decrease pulmonary capillary permeability. Option D, increase mucociliary clearance. The correct answer is option B, reduce alveolar surface tension and prevent atelectasis. Surfactant reduces surface tension in the alveoli, preventing alveolar collapse, atelectasis, and improving gas exchange in conditions like ARDS. Question 25. A patient leaving against medical advice, AMA, must be informed of: Option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. A patient who has decision-making capacity has the right to refuse treatment and leave AMA. The nurse's duty is to inform the patient of the risks, alternatives, and potential consequences of their decision, and to document this thoroughly.